Today we're at the Senior Center on East Ash Street in Goldsboro, the Peggy M. Seeger Senior Center. And you know, we go here quite a bit, and we have had a change in personnel here. We have Selena Beeman is with us this morning. Hey, Selena.
How are you, Wayne?
I'm okay. I appreciate you talking with us. Now, what do you do here now? What's your title?
I am the Information and Options Counselor. So,
all right. What does that mean? What do you do?
I kind of help guide people in resources in the community. So when they have a need for things, we try to connect them with the resources in the community. And we do have some limited resources here that we can help with, but mainly connecting them with the agencies and the people that can assist them.
That's really got to be a great job. You got to really enjoy this.
It's rewarding. It's very rewarding.
Yeah, I can imagine occasionally maybe there's a little troublesome. It's a little frustrating at times, but you dig through and you're able to help people.
Yes, for the most part.
Yeah.
Yes.
All right. So you're not only the Medicare connection, you're not only the SHIP connection, you do a little bit of everything here.
A little bit of everything.
Okay.
I am the SHIP coordinator for the county.
Okay.
Help assist the SHIP volunteers in during open enrollment and doing the outreach to the community to inform them about Medicare and the open enrollment and the opportunity to apply for extra help with Social Security, and if there is a need for them to apply for other services through the Department of Social Services, we kind of help navigate with that kind of stuff.
Wow, okay. Now, tell me about SHIP. I mean, we all know about Medicare, but where does SHIP fall in line with all that? Is that over Medicare? Does SHIP oversee Medicare, or does Medicare oversee SHIP? How does that work?
Well,
or is there any connection at all?
There is a connection as far as SHIP is through the North Carolina Department of Insurance.
Okay, so that's the state health insurance something?
State health, the North Carolina Senior Information Program, Senior Health Information Program.
Oh, okay, Senior Health Insurance Information Program.
Senior Health Insurance Information Program.
Selena, you got to help me out here. Come on. Okay. The North Carolina Department of Insurance Seniors Health Insurance Information Program, SHIIP, SHIP.
That is correct.
Got it. All right.
And while it's in North Carolina, it's also a national program.
Okay.
But what we do with SHIP is help people that are new to Medicare or already on Medicare navigate the system to assist with enrolling in prescription drug plans, Medicare Advantage plans. We can help do comparisons with supplemental plans for their Medicare. And we assist with the low-income applications to help with paying for their supplement.
5, 4, 3, 2, 1.
We assist with helping people with the applications through Social Security to apply for extra help to pay for their drug plan. And in turn, that also alerts the Department of Social Services if there is a need for additional assistance. It automatically sends an application to them.
This is a whole lot of stuff here.
Yes, it is.
Well, let me ask you a question now. Keep it simple, please. I got a simple mind.
Okay.
Let's not get in the weeds here, but I wanted to ask you about Medicare. And very simply, it would probably be easier to ask you who would not qualify for Medicare rather than who would. Well, what are the qualifications if you're not qualified to have Medicare? What is that easier, or can you tell me who qualifies for Medicare?
Anyone that is of age. Most people have to be 65 before they can enroll in Medicare, but as years go on, the retirement age gets a little higher, so some people is 66, but primarily 65. Well, wait a minute.
Primarily 65. Okay, we're going to count down again.
Sorry. Okay.
Look, I do this.
We'll go with 65.
Every day I have to start over many times, so this is everything. Okay, we'll just say most people 65. 5, 4, 3, 2, 1.
All right. Most people are 65 whenever they're eligible for Medicare, unless they have been disabled. Oftentimes, if a person is disabled, they are eligible for Medicare prior to turning 65.
Okay.
So we can assist that population as well.
Okay. Well, that's pretty simple.
So we help people new to Medicare, people that are already on Medicare. During open enrollment, which is October 15th through December the 7th, we look at drug plans. We look at Medicare Advantage plans to see if people need to make a change. Medications change, so sometimes you do have to change your plan.
Yeah.
Sometimes you don't, but it's always best to look at it every year.
Okay, I want to talk about that in just a moment, but what if somebody is, so let's say somebody is over 65 and they're still working. Would they be eligible for Medicare?
That depends on their employer. Some employers will allow you to remain on your insurance through the employer. So most people will enroll in Part A, which is your hospitalization, which is what we pay for our FICA, is what pays for your Medicare Part A. And then when they leave their job and are no longer under the umbrella of their employer insurance, then they can enroll in Medicare Part B, which is the medical insurance.
Oh, okay.
So it just depends on the employer whether or not they allow them to remain on the insurance.
So it sounds like there's just no hard, fast rules, although there's certain guidelines, and you try to adapt to the person's needs.
Exactly.
Well,
and that's what
good.
we're here for, to help them navigate that.
That's excellent. So I wonder how many people are aware of that. I mean, do people realize this, or do they know they can come to you for guidance and help?
Well, I hope they know they can come here for guidance. We'll help them in any way we can.
Well, we're telling them right now.
Right.
All right. So get in here. Right.
Yes.
Okay.
And also, a lot of employers, whenever people become Medicare eligible, their benefits coordinator will tell them that they need to go and apply for Social Security or Medicare.
Okay. Well, some companies are smaller companies, and they may not have a benefits coordinator. So can the owner of a company come to you and say, look, I need help with my employees. Can you guide me about what I can do? Or
yes,
you can help them with that.
We can. I will actually go out and make a presentation or talk with the employers in like an insurance meeting or anything like that.
All right. That's very good. Let's talk about open enrollment. And we've talked about that ad nauseum till, almost every day we talk about it on TV. But let me ask you, it starts in October and it goes through December 7th. But now we're going to end it here on December 6th because why? Because that's a Wednesday?
Well, yes. Here at the Peggy Seeger Center, we actually do the open enrollment walk-in clinic Monday through Wednesday from 9 until 12. And the 6th is on the Wednesday.
That explains
However, I'm in the office every day, so if there is someone that missed that deadline, we will be here to assist them.
Okay, so you try to work with them as well, even though they may not be able to get here during those hours.
Exactly.
Monday, Tuesday, or Wednesday from 9 till noon. Now, why would anyone want to change the plan they're on now?
Well, because the drug companies or the insurance companies sometimes change their formularies. Or as an individual, maybe your needs have changed. You're on different medications.
What's a formulary?
A formulary?
Help me out here. Come on. Speak English, lady.
A formulary is the drugs that a insurance company has that they will cover. Oh. In other words, they have all categories of illnesses, and they have certain medications that they will cover for that illness.
Okay.
While there may be 100 different medications for maybe heart problems, maybe they only cover 25 of those, and the doctor puts you on something that's not covered. So you want to look at your plan to see if there's a plan that will cover that medication.
Okay.
So they all have different medications that they cover, and some are the same.
So that's a formulary.
That is a formulary.
I got it. Okay. Now, moving on. So they will change because things could change during the year.
Exactly.
Okay, well, that makes sense.
And another example why people would change is because of the company that they're with is no longer going to work with their pharmacy.
Oh.
While the pharmacies will accept all Medicare Part D plans, they may not be what is called a preferred pharmacy. So each plan has preferred pharmacies that they prefer to use, and the cost can be cheaper. While if you prefer to go to a different pharmacy, your cost will be greater.
Okay. So as things change throughout the year, and this is not uncommon, it happens quite often, doesn't it?
That is true.
Things change, and it would behoove one who is taking advantage of their Medicare to talk to you about, well, my plan just changed. Can you find a better one for me?
That is correct.
It's that simple, isn't it?
Yes, sir.
That's what you do.
Yes, sir.
Well, that's easy.
A prime example is my dad. He was on a plan that is no longer going to work with his pharmacy next year. And to stay with his pharmacy and to stay with that particular plan, his cost was going to be about $500 more for the year.
Ooh.
So we changed his plan, saved him about $500, and he's happy.
Now, is that an unusual situation, or is that a common situation?
That is common.
Really? That
Yes.
much different?
Yes.
You're actually able to save people that much money?
Exactly.
Well, that's amazing.
Thank you. I can't take credit for it,
Sure you
but
can.
I mean,
Take credit.
no, we can't take credit for it. But it is great that Medicare did build this system that we can assist people in finding something that's going to benefit them more.
So does anyone need to make an appointment to come in and talk to you about this?
If they're not coming in during the open enrollment, I do make appointments.
Okay.
We have people that are new to Medicare all during the year. And when you're new to Medicare, you have 3 months before your date of birth, the month of, and 3 months after to enroll in Medicare without penalty. So you have a 7-month window
To sign
when
up
you're
for it.
first becoming eligible for Medicare.
You mean outside that window there's a penalty just to sign up?
Yes, sir.
Oh, well, don't do that. That's not good. So when they come to you, they can just walk in Monday, Tuesday, or Wednesday, 9 till noon before December 6th and talk to you about their plan. Now, what do they need to bring with them?
They need to bring their Medicare card, the red, white, and blue Medicare card,
Right.
and they need to bring their medications.
Okay, a list or the actual medications?
We prefer that they bring the medications,
actual medications.
because we have to have the dose and the strength of the medication.
Okay.
And know whether they take a brand or a generic. So it's better to bring the medication with them.
Okay. Now, what's the cost for them to bring something in here and sit down and talk to you about this?
Absolutely nothing.
You mean it's free?
It's free.
It's free?
It's free.
How do you get away with that? Well, that's great.
Well, it's just a service that is offered to the seniors.
Okay. All right. Well, that's great. So it doesn't cost them anything. So, and you saved your dad about $500, and that's a common occurrence. So somebody could walk in here and actually save hundreds of dollars.
Yes, sir.
Have we ever kept track of how much money we're able to save for Wayne County citizens?
I don't know the amount that we save for the particular county, but I do know that it's millions of dollars that are saved for people in North Carolina every year.
Just in North Carolina?
Just in North Carolina.
Oh, my.
North Carolina is a pilot this year for the cost savings. So all of our SHIP counselors enter in our reporting system how much we save somebody whenever we enroll them in a plan or change their plan. And so they're tracking that to find out exactly how much money this program or helping people with this through this program saves them.
You know, Selena, I would have to think that maybe North Carolina is doing something right for them to want to look at North Carolina to see the perfect example about.
We hope so.
Yeah, about how to save people money. Well, this is great. Okay. So this information sheet right here, you give this out to people or you mail it out, or what do you do with it?
We do have that. I hand it out when we do presentations. We place it in different locations in the community for people to pick up. We also have posters and things that we send out. We have things posted in the newsletter and in the buzz, and y'all talk about it regularly. So trying to get the word out to people where to come and how to find out if the plans that you have currently are the best for you or if you need to change.
And it's a free service.
It is free.
Free. It doesn't cost you anything. So you walk in, you bring your medications with you, and you bring your red, white, and blue Medicare card, and you sit down here, and you talk to Selena, and you say, this is what I have now. Or can you look it up? Can you look up their plan?
Whenever they bring their Medicare card in, and we put their information in the Medicare website, we can actually pull their information up, see what plan they have, and how much their projected cost is going to be for the coming year. And it will also give us a list of the other plans and what their projected cost is going to be. And that's how we make that comparison to see if there's any savings that can be.
Okay, so how many plans are there? Are there several plans? Are there dozens? Are there hundreds? Are there thousands?
There's
Dozens.
30-some plans.
Really? So somebody should be able to find a plan that suits them, but not every plan is suitable for every person.
That is correct.
Plans will vary.
You may have a husband and wife in the same household that have a different plan, but that's because the plans are generated by the medications that you take.
Okay, so a husband and wife may be on different plans altogether. Mileage may vary. So they come in, they bring all this information, and you sit down and you look them up on the thing there, and then you can find pretty quickly a plan that works better for them.
Yes, sir.
Wow. And this is free.
This is free.
Isn't that nice? That's nice.
And
they don't have to pay for any. Don't charge a dime for this. Okay. So how do they do? What do they? If they have a question, can they call you?
They can call. They can come by.
Okay. What's your number?
It's 919-731-1608.
That's right. Almost had you. I thought I had her right there. Okay, but because you've only been doing this a short while, you're not sure of the number.
Right. So, and they can also call the SHIP office at 855-408-1212.
Okay.
Most of the time when they call that number, they will refer them to us as well. So
excellent. Wow, this is great information here. This is great information. Medicare covers so many different things. They cover hospital stays. They cover, but it's not everything to everybody.
Right.
It doesn't cover everything.
Right.
It covers percentages.
Right.
Is that right?
Medicare covers 80% after your deductibles. You have a yearly deductible with Part B, and you have a deductible with Part A, which can be per benefit period, not just a yearly deductible. So oftentimes people will enroll in supplement plans or what they call gap plans, which is through a private insurance company where they will offer plans that cover the deductibles, the co-insurance, and things like that Medicare doesn't cover.
I see a lot of that advertised on TV, quite a bit.
Right.
But now that's through an independent commercial insurance company. I mean, this is you actually pay for this.
Yes, sir.
You're paying for this. You pay a monthly fee or something like that, or
that
a
is
subscription
true.
rate. Yeah.
And we do, on the Department of Insurance website, we can pull up a list of the insurance companies that are available to offer the different plans. We put in the individual's age, whether they're male or female, and if they use tobacco. And it gives us a list of those insurance companies, and it kind of gives a general price. It's not a this is the price kind of thing, because some of the prices can vary by zip codes and things like that. But it tells if they have a application fee that has to be paid when you apply with them and those kind of things. So it's helpful. It's a helpful tool to help people.
Like it.
And, you know, it shows you the differences in where insurance can vary. Sometimes there's $100 difference in the cost for the same kind of plan.
Really?
Just depends.
Oh, that's great. So you're actually able to help them with that as well. So they have the option of going to a supplemental insurance plan with an insurance company, or paying the 20% out of their own pocket.
That is correct.
Okay, I think I know what I'd do. Okay, because
Well, and there's also Medicare Advantage.
what is that?
The Medicare Advantage is it kind of takes the place of Medicare. You have to have Medicare to enroll in a Medicare Advantage plan. And these companies are contracted with Medicare to offer your insurance. They have HMOs and PPOs that work kind of like maybe your employer insurance worked, where you have copays when you go to the doctor. You have out-of-pocket expense, and some of them offer some incentives like dental care, a little bit of eye care. It just depends on the plan.
So Medicare Advantage it's not Medicare.
Right.
Is it a step up or a step to the side, or is it like a supplemental plan?
Well, like I said, it's sort of like what you would carry with an employer.
Oh, okay.
So like your employer plans, it works a little differently, but it is something where you have copays when you go to the doctor, not the 20% like you have with Medicare, but some of them you may have a $15 to $20 copay when you go to the doctor, and those kind of things. So those are the kind of things we can counsel people on as well.
Is there a premium due with that? Do you pay for that?
Well, what you pay to Medicare for your Part B goes to them. And some of them do have an excess charge other than that. Okay. So that's the kind of thing we look at when we do those comparisons.
So it's either that or you then have a supplemental policy through an insurance company. That would be two different things, wouldn't it?
You have a supplemental policy with original Medicare. You cannot have a supplemental policy with a Medicare Advantage plan.
I'm so confused. I'm glad you're here. I'm glad you're here because there's a lot of questions, and unless you're in the business, you probably don't know everything you need to know about all this. And that's why Selena Beeman is here, right?
Yes, sir. Well, it's something we learn. We're learning every day. I've been doing this since 2006 when Medicare Part D started.
Ah, okay.
And I learn something new every day.
So you've been doing this over 10 years now. All right. Are you from here? Where are you from?
I'm from Wilson.
Are you?
I grew up in Fremont.
Okay, well, that's okay. Well, you're close.
Wilson.
You're not like from Chicago or Kansas or anything like that. Yuck. So you're from here. You're a home girl then. All right, that's good.
But people can come in and see us, but I also do counseling over the phone.
Okay.
Because oftentimes we are kind of a melting pot here in Goldsboro because of the base.
Yeah, exactly.
And people are calling and saying, well, I have parents that live down in Florida. And as long as they have their Medicare information and their drug information, we can do a comparison, and I will actually mail it to them so that they can review it with their parents, and then they can seek help elsewhere.
So this is not just, you don't cover just Wayne County or just North Carolina. You can advise people all around the country.
Yes, sir, because when we put the information into Medicare, we put in your zip code. So it's going to pull up the plans that are available in your zip code area.
Wow, this is great. This is great. All right, 731-1608.
Yes, sir.
Is that close?
That is it.
919, I've got it. 731-1608. Selena Beeman is here to help you with all your Medicare questions and any other questions you might have. You're a source for sources.
Try to be.
A source for resources.
Exactly.
Okay. Selena Beeman, 731-1608. And I thank you so much, Selena.
Thank you, Wayne.
It's great. We'll do this again.
Yes, sir.
Okay.
All right.